Now, the NICD is warning people to be extra cautious of cholera this weekend. It's often used to conduct religious ceremonies, including baptisms. At least 11 cases have been reported in the province, and sadly one person has died as a result. So how do you keep an eye out for areas where cholera could be an issue? Let's find out more from Foster Mohale from the Health Department, making time for us this afternoon out in a village in Bolobedu. Good afternoon, Foster. Happy Easter to you and your loved ones. I appreciate your time. Let's talk cholera for a moment. Most people don't know if they're getting into a body of water whether there could be cholera or not. Just help us understand, what are we looking for?
Thank you very much, Gareth, and I wish you a blessed and safer and healthy Easter holidays. Yes, indeed, as the Department of Health, we wish all South Africans a safer and healthy holidays, but also we'd like to urge all travelers who will be coming or going to cholera endemic regions to take precautionary measures. Yes, indeed, in the country, so far we've recorded about 11 cases and unfortunately one death. Yeah, in terms of the country, as the government, we've been doing enough to raise awareness about cholera, the preventative method, the signs and symptoms, and also encouraging anyone who experiences signs and symptoms, whether they've traveled to cholera endemic regions or out of the country, to go to their nearest health facilities for screening and testing.
I suppose it's going to be very tricky this weekend, isn't it, Foster? Because apart from it being a long weekend, even for those who don't necessarily celebrate and recognize Easter, it's a long weekend. They could be going to dams, they could be going to the sea, open bodies of water. But more importantly, Foster, there's those, as I mentioned in my introduction, there are religious, of course there are religious functions and events taking place this weekend. Is the Department of Health calling for a halt to those religious events, like baptism, for example, where people will need to be in the water? Or what are you advising for those wanting to take part in religious festivities?
Yeah, definitely. As the government, our role is to advise those who will be practicing those traditional and religious practices like your baptism, to say please, especially the leaders, to say please, as you continue to preside over those practices, please try to be responsible, ensure that these practices are taking place in a safer environment to avoid what we experience in the rivers like your Yaske River and the Klep River in Gauteng, because we need to put the lives of your followers, the lives of your clients at first. Hence we say, please, if you continue to take your members or your followers for baptism or any other religious or cultural practices, including baptism, please, we say, please avoid telling or directing your members or your clients from drinking untreated water, which is not safe. So we call upon all the leaders to say, please try to be responsible, act in the best interest of your clients or your followers.
And give me a sense then of the state of readiness the health department is under. I'm talking obviously local clinics and local health centres and of course hospitals. Are you concerned we could see a surge in cholera cases this weekend? Are you putting more staff on standby at hospitals?
No, definitely we have, just like other sectors of government and society, we have ensured that all our health facilities, they remain accessible at all times. We also try to set up some mobile clinics in some areas, especially where there's high traffic volumes, in order to ensure that those who experience any health challenges, they can quickly go and consult there without waiting or traveling in a longer distance to the nearest clinic or hospital. So hence we say we're working closely with other sectors like your police, your transport officials, to say, please, let's try to work together and also encourage people to say, those who are traveling a longer distance, of course, we know that other people will be traveling from out of the country, others will be coming into the country, others will be coming from endemic countries like your Malawi, Zimbabwe, Zambia, and Mozambique. We say, please, if you happen to experience any signs and symptoms, please, or any other health challenge, please don't waste your time. Also, we want to call upon the parents and the legal guardians, as you know that while we are busy battling with the detection of cholera in the country, we are equally battling with the spread, the rising number of measles across the country. We want to also urge our parents, the legal guardians, to say, please continue to take your children who are not immunized to your nearest clinic or healthcare center or the hospitals in order to ensure that they get vaccinated in order to protect their lives, because the children are our future leaders.
Of course they are, and they're so little as well. They're so vulnerable, aren't they? And it's terrible to see them sick. And it's just a simple immunization and vaccine. Foster, I want to just circle back to the beginning of this cholera issue. Right now, you've made it very clear how the department is going to handle this and what your call is to protect yourself this weekend as an individual. But where are we on trying to understand why there is this outbreak of cholera? Where is this coming from? How are you getting your information? Who's advising you, and where are we on trying to get on top of this cholera outbreak?
Yeah, as you have indicated during the introduction, that we are working closely with our entity, which is the National Institute for Communicable Diseases, known as the NICD. They are the ones who are advising us technically in terms of epidemiological report, in terms of where we must look at. Just like we've announced a few days ago that we have suspected the rivers like Yaske and Klep River as the possible source of local infections in the country, even though the results came back negative. But that does not mean the water from those rivers or any other source of water like your dam, your river, your stream is safe. So hence we keep on encouraging our people to say continue to use the water from the tap because it's reliable for drinking or preparing food. Don't use any untreated water from sources like your rivers. The fact that the results came back negative does not mean the water is entirely safe for drinking or consumption. So we work closely with the NICD and other sectors of the society like the World Health Organization to say, please, let's continue to protect our people. Let's continue to empower our people with the health education in order for them to make well-informed health choices.
Yeah, and I think the easiest choice to make, Foster, as I say goodbye to you and thank you and I wish you well for the weekend, is just don't drink any untreated water, any kind of open body water, perhaps just avoid, just to be extra careful. Foster Mohale, thank you very much indeed for your time. Be safe this weekend. I'm sure we'll talk again. From the Health Department, calling anyone who has children who have not been vaccinated against cholera to either get that done or this Easter weekend to be extremely, extremely careful. Also those taking part in religious ceremonies, especially when you are going to be in water, for example, baptisms, to rather delay that and just double check the quality of the water you're in. And as always, when in doubt, simply don't.